Hello, my name is Jade Kandel, and I am a PhD student at UNC Chapel Hill. Parkinson's disease symptoms include unintended or uncontrollable movements. To slow the progression of Parkinson's, physical therapists want to create tailored therapies, but doing so requires understanding of the patient's motion patterns. We developed PD Insider, an interactive visualization system for analyzing a person's daily movements for clinical review and decision making. People with Parkinson's disease develop various motor deficits, such as poor balance and shuffled walking that can lead to falls and difficulties walking, grabbing objects, and standing up. While physical therapy can help, recommended treatment requires insight into how individuals perform various motor activities over time. Clinicians currently only have access to information about a patient's movements through brief clinical sessions and self-reporting. However, it is unrealistic to expect patients to be able to remember so much detail. For example, let's say the patient recalls struggling to stand up from the couch. If a clinician knows that the patient is leaning to the left while trying to stand up, the clinician can recommend physical therapy exercises that focus on centering balance. Without this information, the clinician's decision-making is hindered. We introduced PD Insider, a system for clinicians to study a patient's in-home body motion data. PD Insider uses motion capture data, action labels, and environment videos to provide a multifaceted view of daily body movement. In the future, we envision collecting large amounts of data in a person's home. The primary contribution of this paper is the visualization that enables clinicians to analyze large amounts of motion data for Parkinson's disease treatment. To do so, PD Insider uses a desktop-based overview dashboard for presenting motor patterns and struggles during activities of daily living, and an immersive replay for closely studying the patient's body movements with environment context and augmented reality. Here are the primary sections of our talk, which will start with a task analysis. Our work is deeply informed by the tasks and data needs described by clinical experts. Next, we will describe the system design of PD Insider. Finally, we evaluated our system using a Think Aloud study with 6 clinical experts and highlight our key findings in the discussion. From multiple discussions with physical therapy experts, we identified key tasks for clinicians to use data to understand a person's mobility. We grouped these tasks into 3 high-level goals: identify and filter data by action, discover motor deficits, and contextualize motor deficits. Patterns clinicians look for in motion data depend on the patient's action. For example, significant leaning forward while walking may indicate imbalance and struggle to walk, whereas the same variations are normal when standing up from a chair. While other actions may also inform protocols, we identified these 7 common actions as especially useful for understanding a person's condition. With potentially hours and days' worth of body motion data, finding moments of motor deficits is challenging. To enable clinicians to find these important changes in motion quickly, we can use statistical metrics such as body angles and displacements to show if, when, and why a motor deficit occurred. Poor posture is a common symptom of Parkinson's and can lead to falls from poor balance. The trunk angle captures posture, showing how far a patient's upper body is leaning. Asymmetric arm swing while walking is an important indication of Parkinson's. We can infer when one arm is swinging more or used more than the other by looking at patterns in the distance between each hand and the pelvis. Gait freezing is when a patient is temporarily unable to move their feet forward when trying to walk, which can lead to a fall. We can infer gait freeze events when the feet suddenly stop or strides grow unexpectedly short while walking. Imbalanced weight shift can create struggles sitting down, standing up, or standing still. We can infer when one leg bears more weight based on the displacement between the pelvis and the foot from the side direction. Context, such as time of day, symptom and action duration, and where the person was in their house, can indicate why an observed symptom happened. Temporal context, such as if and when someone took their medicine, may impact observed symptoms. Carpet floor changes, doorways, and turns can trigger a freeze event. Patients might also rely on their surrounding environment for physical support, such as leaning on a table while walking. Direct study of the person's body and environment captures important context that numbers alone may overlook. We support these tasks and data needs through our system design, which starts with data collection and processing. We share our current methods for collecting and processing data, as well as what we envision for the future given current research. We collected body motion data from 3 external cameras and IMU sensors on a tracked person in a room with pretend living room and kitchen. We recorded motions from members of the research team and a person with Parkinson's disease. External cameras are a temporary method for capturing data. Given the direction of current motion capture research, we anticipate in the future that this data can be captured in a patient's home without intrusion by using wearable sensors and cameras embedded in lightweight glasses. PD Insider processes the collected data to create an environment mesh, action labels, human body pose estimate, and body variables. The environment reconstruction provides important context for understanding body motion and a potential motor deficit triggers. We currently use a video of the room to generate a 3D mesh of the environment. Action labels indicate the action performed at a certain time, such as walking or sitting. These labels help the clinician analyze body movement. Currently, our test dataset uses manually entered action labels for higher accuracy. Given the direction of current video recognition research, we envision in the future using computer vision for more efficient action labeling. For enabling quick finding of motor deficits from lots of data, we compute relevant body variables consisting of numeric body displacements and angles of interest by using the positions of the pelvis, hip, neck, hands, and feet. The processed data is passed into the visualization components, the overview dashboard, and the AR immersive replay. These 2 systems work together to enable both broad exploration and close investigation of the motion data. To demonstrate the visualization system, we will show a workflow that all clinicians used when trying our system during the evaluation. Clinicians start with the desktop-based overview dashboard. Clinicians begin by selecting an action of interest. Clinicians selected walking because struggles with walking can lead to falls and are important for understanding the patient's condition. They view updates to display walking events. PD Insider represents each walking action event with a horizontal orange bar, whose width is proportional to the duration of the event. The length of the event can provide temporal context and indicate if a patient is struggling to complete a selected action. Since there are so many walking events, clinicians use the additional action filters. For example, all clinicians were interested to see if the patient had struggle walking. By selecting potential freeze, only walking events with predicted gait freezes are shown, with predicted gait freezes represented with light blue bars. To help clinicians discover motor deficits, body variable controls allowed clinicians to display relevant data. Clinicians were interested in walking posture since gait freezes often result in poor balance. A temporal color-encoded heat map shows the trunk angle data over time, which enabled clinicians to quickly spot patterns and outliers. To make values darker and more salient, clinicians often used the body variable color legend sliders. After selecting action, body variables, and action filters of interest, the clinicians looked at the presented data to find body motion patterns and outliers. For example, many clinicians noticed increased leaning forward during this predicted gait freeze event. After finding this moment of interest, the clinicians clicked on that action event to focus exclusively on data for that event. Finally, the clinicians used the play-pause buttons or play slider to fetch video and reconstruction replay. Clinicians confirmed the presence of a freeze event with the replays. While clinicians had access to the video replay, many preferred using the immersive replay, which renders a skeleton and environment reconstruction in augmented reality. Clinicians are accustomed to physically maneuvering and examining a patient's body in the clinical setting. Body variables are visualized using arrows, which clinicians found helpful for understanding motion direction and distance. Clinicians moved between the dashboard and reconstruction without removing the headset. By finding and studying moments of interest, such as a gait freeze event, clinicians can better give personalized suggestions to the patient. We evaluated PD Insider through a Think Aloud study with 6 rehabilitation specialists. Of the 6 participants, 5 participants had direct experience with Parkinson's disease, and the 6th works with people with stroke facing similar mobility struggles. The therapist analyzed a 50-minute data set with movements performed by members of the research team and a person with Parkinson's disease. We intentionally captured a range of movements and motor deficits. From our evaluation, we found that clinicians were able to successfully find moments of interest and contextualize moments of interest. Participants commonly focused on events with dark-colored outliers in the temporal heat maps. For example, participants were interested in moments where the right arm heat map was close to white and the left arm heat map had dark green bands, which showed imbalanced arm swing. The environment provided participants with important context. For example, when watching the reconstruction in the immersive replay, one participant said, "This shows me that they were furniture walking while using furniture as an assistive aid. Before in the heat map, it looked like they were walking weird. I would have thought they were about to fall." The context of the table was needed for making sense of the motion data. Here we summarize our findings to inform future work for studying body motion data. Our evaluation showed that action labels and body variables successfully work together to indicate motor struggle and enable deeper and faster analysis. Given clinicians limited time and the large amount of data, emphasizing outliers using dark colors and adjustable sliders helps draw attention to potential motor deficits. While participants had access to a video replay, they primarily used the augmented reality headset for watching body motion because they could view the body and environment from multiple perspectives, showing that immersive renderings can improve 3D body motion analysis. A big thank you to all the collaborators who have helped make this happen. Together, we work towards a future where clinicians can remotely monitor patients to better personal treatment and improve clinical decision-making for Parkinson's disease and other medical conditions. Thank you.